Let's say that you and I both have Blue Cross Blue Shield insurance, and we just happen to live in different states. We have the same illness, and our doctor recommends the same procedure. Well, is the service going to be covered based on medical necessity? We should both have the equal answer. If everything's the same, it should either be covered or not covered for both of us. Right? If you think so, you must be new around here, because we're in the Healthcare Twilight Zone. Hi, my name is John. I'm your healthcare hacker and the host of the Healthcare Twilight Zone. Today we're going to talk about medical necessity rules and how they're different based on what insurance company you have. And I'm going to give a very specific example around Blue Cross Blue Shield, but this could apply to any insurance company with some minor tweaks. Our story today is about Cathy and her journey through the Healthcare Twilight Zone. You see, Cathy's been dealing with some pretty severe intestinal and GI issues. I won't go into details, but they've been going on for several months and not getting better. She's seen her primary care doctor. She's seen a specialist. They've done a colonoscopy. The doctors can't figure out what's wrong with Cathy. And they're starting to get concerned. She's losing weight. So her specialist orders a lab test that's pretty rare and pretty expensive, about $1,500 to have done to determine what's really wrong with Cathy. So let's start with the good news. The good news is the lab test successfully identified what was wrong with Cathy, and her doctors were able to start treatment that got her on the road to recovery. And she's doing fine now. But there's bad news. There's always bad news in the Healthcare Twilight Zone. And it has to do with the billing. You see, the lab test wasn't covered. And why it wasn't covered is truly unique and bizarre. Here's where it gets complicated. You see, Cathy has Blue Cross Blue Shield insurance. Now she has it from her employer, and her employer is headquartered in, let's call it state A. But Cathy lives in state B, and that's where the test was done, in a different state than her home Blue Cross plan. Well, surely the two Blue Cross plans between these two states have the same rules around medical necessity, right? The lab test is medically necessary. They've got the literature, they've got the documents that show it is or it isn't. Well, that's where the problem is. They don't agree. You see, state A has very stringent rules. There's only incredibly few circumstances where this lab test can be done. Whereas state B's Blue Cross plan has much more liberal. Why? Don't know. No idea. The doctor didn't know. He didn't even check state A. So when he did the procedure, it got denied as not being medically necessary. And not only that, Cathy was responsible for the bill. Now, I don't know where the fault lies, right? Should the Blue Cross plans have the same medical policy? Probably. Should the doctor actually check the medical policy of the plan that Cathy has? Yeah. But I do know this. The one party in this whole story that shouldn't be financially responsible is Cathy. And guess what? She's the one that had to pay the bill. You see, she appealed it, tried to get overturned. Didn't work. They denied it. The doctor wouldn't forgive the bill, admitting his mistake. He wanted to get paid. So Cathy was stuck. She had really no options. She could either get reported to collections and have her credit score impacted, or pay the bill. She ended up just paying the bill. And that's a sad part of the Healthcare Twilight Zone. The consumer, you and me, end up paying for stuff that we have no control of. There's literally nothing Cathy could have done to avoid this bill. But unfortunately, after the fact, she was stuck with it. And that's, in essence, the Healthcare Twilight Zone. We are the ones stuck paying the bills. We are the ones stuck paying for the mistakes, the errors, the complexity, the confusion. It's not the insurance companies. It's not the hospitals, not the doctors. Too often, we are the ones caught in the middle. Well, this brings us to the end of the Healthcare Twilight Zone series. It's kind of sad. There's so many more stories that we could tell from just ourselves and from our members. I'm sure you have stories. We'd still like to hear from you. So please leave them in the comments below. And like this video and subscribe to Athos' social media channels. We want to hear from you. We want to get our message out, and you're our best way to do that. Okay, time to go back to the real world now. Make sure you get the facts by joining me in the next episode of Healthcare Hacks.